Hey guys, welcome back to Medical Coding with Blue. Now it is Q&A Tuesday. So thank you so much for putting up with all my video uploads today. Just a lot of stuff going on, and of course, I had to post for Answer Monday, Tuesday edition. So anyway, let's go ahead and get started. So number one, and thank you to all the people who submitted questions. All right, so number one, what are the different medical coding credentials for each association? So with the American Health Information Management Association, we have the CCA, which is Certified Coding Associate, the CCS, which is the Certified Coding Specialist Physician-Based, and the CCS, which is a Certified Coding Specialist. We have the RHIT, which is the Associate's degree, the Registered Health Information Technician, and then we have the Bachelor's degree, which is the RHIA, the Registered Health Information Administrator. So there's all these other credentials too. They have other specialty credentials. I didn't want to list all of them. I just wanted to name those ones really quick. You can check the website, ahima.org, ahima.org. And for AAPC, I don't know a lot about AAPC, guys, because I'm not an AAPC member. I'm only going to say the one, but they have a whole bunch of different ones. But the one that I know of is the CPC, the Certified Professional Coder. When you first take your exam, they're going to have a little A at the end for apprentice. So it'd be CPCA. After you have time in with your credential, or when you go through a little program that they have to remove that A, then it'll get dropped and you'll be just a plain CPC. Okay, and they have, like I said, they have other specialty credentials. Be sure to check their website, aapc.com, and I will be leaving both website addresses down in the description box below. All right, number two, what is the website for the CCA prep, the Certified Coding Associate? They have a online program. If you are interested in taking a online course for the CCA, the Certified Coding Associate credential with the American Health Information Management Association, it is on their website in the section with all of the programs, and it is under Coding Basics course. Okay, you can be able to take that. It's got everything bundled in it, and it's got everything to prepare you for the exam. All right, I will probably leave the link down in the description box. I will update it later. But I know as soon as I get done with this, I'm gonna upload it, and then I will probably leave the link down in the description box. All right, so if you have any questions about it, you can check it out there, okay? And on what it includes in that package, okay? Number three, what is the website for the global days? So if you are interested in finding out what the global days are for a particular CPT code, United Healthcare has it. I'm going to leave the link down in the description, but you can click on it, and any CPT code you're looking for, and I think the last time it was updated was in 2017, but the global days are not going to change, okay? So it will tell you if it is a 0-day global, or if it's got maybe a 10-day global on it, or a 90-day global. So this way you can look up the procedure code, and you can find out that way. You can also look it up in the book. But like I said, if you don't have the book, you don't have an encoder or something like that, but you still want to know what the global days are, that is a really good resource for you, okay? Let's see. Number four, do you ever get emotional reading a chart? Yes, I have gotten emotional reading a chart. Do you expect anything less from me? It's only happened really a couple of times. And it's just really, it was sort of like the way it was written, it was very poignant. And the couple times that it did happen where I had to like stop, and I was just like so overwhelmed because of the situation. And but when those things happen, you have to sort of stop and think that you are a professional, that you have to sort of put your own private emotion aside to be able to get through that encounter or that record. I know this is easier said than done. No one is telling you to just plow right through it like a robot. You can take a step back and just relax for a minute and just gather yourself, and then you can. I'm not saying that it happens. It's some people never experience this in their career. It really all depends on what is going on. What clinic are you coding for? And somebody had mentioned that they were concerned about doing like a NICU, or the neonatal ICU. That would be very hard to do, because mentally you're thinking about these infants and you're thinking about their parents and things like that. But at the same time, as I mentioned, you're a professional and you are doing that patient a service by making sure that their encounter is coded properly. That's how you can think of it as well. You can sort of be able to take yourself out of it, like your own private emotion out of it for a moment, just to get through that encounter. Because what ends up happening is when you're looking at this documentation, of course, you're getting into reading it and things like that, and you're finding out all of this information and stuff. But you can make sure that it is properly coded, and that is your contribution to making sure that this patient is well taken care of, because at least you know their encounter is being coded properly. If you are making sure that you're going over it very well and taking your time with it. Hopefully that will give you some sort of peace. Like I said, I know it can be emotionally taxing if you're really thinking about it, but sometimes you do just have to concentrate on just what is being said in the documentation, what is the story that is being told, and you have to be able to translate it into codes. So this way that you know that that patient's record is being well taken care of. And so, like I said, hopefully that will help you to be able to get through that. But that is something that does happen, and it'll happen out of nowhere sometimes. And like I said, some people don't experience it in their careers and other people do. So if it does happen to you, just take a step back, and nobody's going to expect you to just sort of plow through it, but just sort of get yourself in check, and then just regroup and get going again. You will be able to do that after a while. Not that you become numb to it, because how can anybody ever become numb to that kind of thing? But you also know that you have a job to do, and you have to make sure that you do this efficiently and timely. So after a while, you know, you will be able to get through those kind of difficult charts. And then, of course, you get those comic reprieves. I've seen some funny instances in records that, you know, make me laugh, whether it is something that the provider wrote. And it's usually what they write. And then sometimes it is a dragon dictation error, which those are really funny. When you see those dragon errors, it's like, uh-oh. Because they come out with some like really weird things. And so, but anyway, moving right along. Yeah, after a while, you know, your reading speed will of course increase, and it will get easier. But it's just a matter of going through it. That's all. And so just know that if it does happen to you, that if you get overwhelmed, that it does happen. It happens to the best of us, even to the most seasoned coder. It can happen. So the important thing is to know that you are doing a service for that patient, and, you know, maybe taking yourself out of the equation and making it about the patient will help. Okay, so that's my advice on that one. Let's see, number 5. How does a coder manage or allocate time to research while still reaching their productivity goals? Okay, so I think I need to do like a separate episode about that question. But I will say this. So sometimes you guys will hear me talk about having to do research for like trying to understand in the chart what's going on and things like that. And yes, sometimes these things do take time, and I hate it because like sometimes I'll be stuck on a record for like an hour, and I'm like, oh my gosh, now I gotta hurry up, and I've got to really sort of get through these next few encounters quickly. What happens is I know my providers that are more straightforward and easier to get through, and I know my more complex ones. So when that happens, I use the ones that are more straightforward, and I can balance things out. Sometimes I get lucky and I'll have a provider that has a class, and so there's a lot of sort of the same thing going on. So I'm able to get through those encounters rather quickly. And so that can sort of make up for that time that I spend downtime looking for stuff. But what happens with productivity is, at least for my facility, it's the average of 90 encounters per day. This means that if I have one day where I am just barely hitting 75, because sometimes that does happen because some of these charts are kind of long. If I can only hit 75 that day, and then the next day I hit 90, but then the day after that I hit 110, obviously when you average it out, it's going to average out to 90, 90, 90. Okay. Of course, I just did mental math, and that was probably like a little off, but you get the idea. Okay. Time that is spent doing things other than coding for us gets taken out. So if I have a meeting that's an hour that I'm going to be able to take off of my workload because I was not coding for that 1 hour because I had a meeting. If I am doing education things, like as far as like being able to maintain my access at work, because sometimes like with HIPAA, you have to do a HIPAA course every year, and that takes time. So I get to take that time off of my day, so that I can put it on my workload and be able to account for that time. Because obviously I'm not going to be coding for 8 hours if I'm going to meetings or if I'm doing education. These are the good record keeping that you have to do to be able to support your not being able to make quota sometimes. And then there are some days when you're just able to fly right through those encounters because everybody's doing what they're supposed to be doing. So if you get those really good days and it just so happens that you do more than your designated amount that you're supposed to do, it will help on those days that you are a little bit lower than you should be because you were having to do a little bit of research. If you're having an issue with a provider, the best thing to do is make sure that you're documenting everything, whether you are counseling that provider as far as like how, what's going on with their documentation, or you're having to query them a lot. Also talk to your supervisor. Let them know that what's going on. So this way they don't think that you're just sort of goofing off and not really trying to work hard. You are trying to work hard. Sometimes these things take time to get right. But once you get them right, it's easier later on down the road. Now, obviously, you can't say every day, oh, I worked on hard charts today, every single day. Come on, man. You know what I mean? Like, that's when it's just like, no, something's wrong there, But if you are trying to balance out those days where you have like really hard stuff, and then you're sort of going with your more easier stuff or your more efficient, records that you can code rather quickly, that's how you balance out your time. But always making sure that you keep in mind to take really good records is like of your day and like what's going on. That really does help you, because like I said, you got to be able to account for that time. And if a provider is just taking a little bit more time, sometimes that just happens. So, but like I said, I will be doing a video separately about that one because I think it's important. Sometimes I think it's a little bit more explanation is needed about the production standards, because I do get a lot of questions about production standards, and every facility is different. Every facility is going to have a different set of criteria for production standards. Some it's like maybe 15 charts, and then some it's 22 charts. I've been, I've had that standard before where it's 22 per hour. And let me tell you, that was rough, because you're literally not able to breathe. You're literally just coding all day. You're not looking at anything but that chart. And then after a while, it's just like, okay. And then, then it sort of petered out. So, it really all depends on where you are, the complexity of your clinic, and what the standards are for that. But like I said, I will be doing another video on that one. Okay. The next question. If you are credentialed with one medical coding association, can you be credentialed with another? Of course. There's no where you have to only be with AHIMA or you only have to be with AAPC. But I will say this. If you have more than one credential with more than one association, with either both associations, keep in mind you have to produce continuing education units. All medical coding credentials require a certain amount, and it's different for every credential, a certain amount of continuing education units. Okay, so that's the first thing. With the American Health Information Management Association, for the credentials, we have like CCS, CCSP, and CCA. We have self-assessments that we have to do. Some of the other specialty ones I'm not really sure about. I haven't really done too much research about those, but I know for certain those we do have to do a self-assessment. AAPC folks don't have that, but they do have where they have to have the continuing education units. So keep in mind, the more of an alphabet you have after your name, the more associations that you are involved with, the more money you're going to have to put out to be able to maintain those credentials, okay? So that's just something to keep in mind. Some facilities will pay for your coding credentials, so you don't have to worry about that. But if you are having to come out of pocket for that, that's something to keep in mind. And also, some facilities, not all, but some, will pay for your membership dues to either association. Sometimes that is a benefit. So again, something to keep in mind, because it's easier when you are a member. Okay, because sometimes they have like non-members too, but the non-members are usually paying a higher price for their credential maintenance or whatever the case may be. So be sure to consult with the association websites for that information. All right. Let's see here. Our nurses, number 7, I'm sorry. Our nurses started with a higher pay range to be a medical coder based on their experience. It depends on where you're applying, okay? Some facilities like that. Some facilities get very excited when they see a nurse that is a medical coder, because a lot of times they will want to put them in CDI or clinical documentation improvement slots. I've seen facilities do that, where they got very excited when they found out that a nurse, is a medical coder, and they feel that they would be in a good place to do clinical documentation improvement. There is a credential for that. But again, there's positions for that that they like to put nurses in, because nurses are going to be able to look at documentation and understand what's going on. And because they've had much more education about it, it just suits them in a good, it sets them up for a good pathway for that position. But again, it all depends on where you are applying. So I can't really answer that question on whether or not you would get more money. It would just depend on where you are applying. But I will say that facilities do get very excited when they see a nurse that is a medical coder as well. So, and I don't know if it's just like a maybe an instructor thing, they feel like a nurse can talk better with a doctor than a medical coder. It just depends. Or maybe they feel like nurses have more experience talking with doctors. That too. But then you can't really account for people like me who do talk to doctors anyway, and I'm not a nurse, But I am good at it. I am good at talking with providers. So, but that is, like I said, that is something that you have to learn, that's not something that you can pick up overnight, so I don't know. But that answers that question, hopefully. All right. Next question. Do you have to pay for CEUs? No, I do not. It's a benefit of my employment. Sometimes that will happen. It depends on where you're working. And I hate saying it depends, but it really does depend, because every facility has funds for different things. Some facilities will pay for their coding staff to go to association annual conferences. I am not high up enough on the food chain in my facility, unfortunately, to be able to have them pay for me. Although I would love that. But I am not high up enough on the food chain. I pay for myself to go. Which brings me to my next question. Is attending conference mandatory? No, it is not mandatory. But it is a lot of fun to be able to go to annual conference. And if you've never been to one in your entire career, I would strongly suggest it, because it is a learning experience. Both associations have their own annual conferences, and they have them in like really cool places. I know AAPC has had theirs in Vegas. I would love for AHIMA to have theirs in Vegas. Just saying, hint, hint. Because I love Vegas. But they've had it in like really fun places. AHIMA has had theirs in San Diego. Very beautiful. Baltimore. Really good food in Baltimore. And they've had it in New Orleans, which Bourbon Street was a lot of fun. Let's see. And of course, in Chicago and Miami. Oh my God. I had so much fun in Miami. I loved Miami. Okay. The food. Oh, I remember the food from... and the drinks. Oh my gosh. Now, it wasn't too long ago. But Miami was a lot of fun. I really did like Miami. I always enjoy conference. But I do have to say, if I have to rank them, I would have to say San Diego would be number one, and Miami would be a close number one. But I'm just saying, I really enjoyed those two. Not to say that I enjoyed the others, because I really did. But those were like some of my most favorites. So, but oh my gosh, the mojitos in Miami. Don't even get me started on mojitos. All right. So, which brings me to the last question. What do I do if I'm being seen in the post-operative period and I am being charged for a regular visit? Okay. If this happens to you and you just say you had a appendectomy, okay, 90-day global procedure, and you're going for your follow-up, and then you get a bill and it says it's a regular visit, E&M, regular office evaluation and management code, and you know that there was nothing done but the post-op visit. Put in a query about that. Challenge that bill. Do not just sit there and be like, oh yeah, okay. Ask them, what do you mean by this? It is okay to question your bills. Even as a medical coder. Doesn't mean that we always know, right, what's going on, but if you are in the post-op period and the provider did not treat you for anything else and you are only being seen for that post-operative condition, you are in the global period. It is okay to question your bill. That's all I'm saying. And I'm going to go ahead and close this one up because, again, I don't want this to shut off on me and my phone is about to die. So I will go ahead and close this up. But what a great Q&A Tuesday. So I will see y'all in the next episode. I've got a really good episode planned for tomorrow. So I will see y'all then. But if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. All right, I will see y'all on the next video. Bye.